Hello, awesome ladies. How's it going? It is Wednesday. I'm going to see who's going to jump on with us, and better turn my phone volume down so I don't hear myself echo. And, it's awesome to be with you all again, and I hope you're having a great evening. I have a really fun announcement to make tonight. But first, I am going to well, let's do that announcement. Let's just get that over with. Let's get it done. I am going to be doing another ladies only masterclass, 5-day masterclass in beginning October 2nd, and it goes through the 6th. And it's another Fix Your Thyroid masterclass. So it's going to be every evening, 7 p.m. Pacific Standard Time, 8 p.m. Mountain Standard Time. And I'm excited to spend this that week with you. We are going to be discussing the most effective way to fix your thyroid. We're going to talk about why you still have low thyroid symptoms, even though your labs are normal. We are going to introduce to you a step-by-step thyroid blueprint that has helped thousands of women like you to regain their health. And we're going to be discussing why, how to determine what thyroid supplementation you will need or might need. Also, we're going to discuss why you should not believe that this is all in your head, nor should you believe that why you shouldn't believe that it's just because you're getting older, because it has nothing to do with age. And please, that you do not accept your new normal. This is among several other topics I am going to be discussing and sharing. And those of you who have attended my masterclass in the past know how very valuable this information is. It's my desire to share with you information that is actionable. It is something you can use. It's helpful, and indeed, it can be and is life-changing. And many of you who are even listening tonight have been through it and know what I'm talking about. So, yeah, I'm excited. I can't wait to spend that week with you all. This it is free. There is no cost to it. So, gosh, what do you have to lose? In fact, you have so much to gain, especially when you're dealing with so many, so many of these low thyroid symptoms. And I'm going to be discussing one of those tonight as we get into our Wellness Wednesday topic. So we're going to discuss chronic fatigue syndrome and chronic fatigue. And but first, I do need to give my disclaimer, as I always need to do, as we, on these live online events. So first of all, anything I say tonight in this Wellness Wednesday is just health information and should not be misconstrued as specific health advice. Do not start taking or stop taking or change the way you are taking any of your medications. And if you feel like you need to, please consult with your prescribing practitioner so that they can, help you make the appropriate adjustments. And attending this Wellness Wednesday does not establish a doctor-patient relationship. Okay, there we have it. I believe it's every day I hear patients talking about their lack of energy. As I visit with potential patients in consultation, as I visit with patients who are, have decided to take the steps necessary to fix their low thyroid symptoms, who are just starting out with low energy. I hear about it every day. it is one of the most common, we'll say, complaints that I hear. And so I think it's apropos to talk about that tonight. Chronic fatigue syndrome, let's just kind of go with the medical diagnosis, is severe fatigue that is not improved with rest. So no matter how much sleep you get, you are not rested. You go into the next day often feeling like you never went to bed. It can be very debilitating, where you are unable to even do your usual activities, and maybe even unable to get out of bed. Often this syndrome is characterized by sleep problems. So you might not sleep through the night. You might have very interrupted sleep. You might have long sleep latency, which means you have difficulty getting to sleep, or you have trouble maintaining sleep. So like I said, you wake up and stay awake for several minutes to even hours before you can go back to sleep. This kind of sleep pattern disrupts the normal sleep, or I should say sleep cycles and brain waves that you really need to establish during truly restful sleep. And then let's see, this syndrome is characterized by post-exertional malaise. So it can be brought, this tiredness, this extreme exhaustion can be brought on by not only physical, but mental exertion. So just being at work, at your desk job, where you're struggling while you're working, especially after you get home, you're beat, you're exhausted. And it's sometimes difficult to understand how can just sitting at a desk doing the work you're supposed to do make you so tired and exhausted. This syndrome is also characterized by problems thinking or with concentration. So it really does impact your brain function, and you have what you might call brain fog, serious or just to an annoying level. You can also have pain with this, especially when you have post-exertional malaise. This is often accompanied by pain, muscle pains, muscle aches. We're going to discuss some of the causes for this that unfortunately doctors don't take the time with you to examine why you have this. And all they'll tell you is, well, there's no cure for it, but we can certainly treat some of the symptoms. You can take some stimulant medication to maybe keep you awake during your workday. You can take more than stimulant medication. You might you might just take it upon yourself to down all the caffeine you can, all the sugary and caffeinated drinks you can to just get through it. Monster drinks, at least high taurine and caffeine and other types of energy drinks. I think back to a patient that I had when I was in traditional medicine. I was practicing family medicine. I had a pharmacist who I interacted with because I also worked as a hospitalist, and this hospital pharmacist became my patient. He had heard that I don't know, I guess heard that I listened to my patients, and he wanted to be my patient. And so come to find out, he had been relying for years on stimulant medications to keep him awake. Things like modafinil. Now I'm forgetting the brand name. Anyway, it's designed to keep you awake. And I'm not talking about the stimulants that you would, that kids would get for ADHD, but we're talking about, Provigil. That's it. I think of it. I've just been out of that scene for a while. He couldn't get through his job, his work without it. And so I obliged and prescribed the medication. I think back to those experiences, and those were the tools that I had. Now, and I'm going to talk about some of the causes that I wish now I would have been able to really help him with. I brought up a few things with him. I brought up some dietary, because I had been really studying nutrition. And I brought up some nutritional tools that I hoped he would embrace, but it really never happened. So anyway, just thinking back to that, it's sad that all we have as doctors, regular, typical doctors, all we have as tools are these pharmaceuticals. So that's why they say there is no cause, there is no drug there is no cure for chronic fatigue syndrome. So all they have is drugs to treat the symptoms. One other symptom that you might have with this is dizziness or lightheadedness. And these symptoms may come and go even. They may not even be, permanent. I think that that would really suck if they were really permanent, and some of you might be dealing with that. So what could be the possible causes of this chronic fatigue? And if you haven't been diagnosed with the syndrome, certainly chronic fatigue is similar, right? You lack energy in disproportion to your level of activity, or to the lack of, maybe you don't even lack sleep, but you're just tired. You're just, even exhausted most of the time. And it's hard to get yourself going, and it's hard to get it's hard to be motivated to do just mundane tasks, just simple housework. It's really quite a problematic issue. Anyway, so let's talk about some of the causes and how we can assess for these. Certainly low thyroid, hypothyroid, that has been misdiagnosed, that has not been found. Why? Because your labs are normal, and doctors aren't going to dig deep enough to find really if this is your thyroid hormone not functioning well for you. So it may not even be, it may not be found by a normal TSH, and it won't be found by a normal TSH, but is that really, all there is to it? This could happen because of adrenal fatigue. I know this gets thrown around a lot. I did a Wellness Wednesday on this topic, and it's really important if you have, and for those of you who may not have watched that, go back and watch it, please, to further understand, because I'm not going to get into the detail tonight that I did then. But certainly adrenal fatigue, when your adrenal glands stop or decrease because they just can't keep it up, the production of your stress hormone cortisol. That's what kind of keeps the fire lit under you. It's what keeps you going and keeps you on task. And certainly if you have too much, that's a problem as well. But adrenal fatigue is characterized by low production of cortisol, the stress hormone. And there can be others. You can be low DHEA, which the adrenals also produce the hormone DHEA, which is helpful for producing testosterone and estrogen. And ladies, you do need testosterone to not feel fatigued. So you have energy. Of course, it's helpful for sex drive and muscle tone, to help you preserve muscle tone. But ladies, when you lack testosterone, you will be fatigued. All right. Okay. Lyme. We're going to talk about Lyme disease, tick-borne disease, also carried by mosquitoes and other insects and arthropods, spiders. And that's, the toxin that the Borrelia bacteria produces when it gets inside your body, inside your cells, is has the effect of causing fatigue, among many other things, many other symptoms, including pain. So those of you who have increased pain with this, with exertion or even mental exertion, physical or mental exertion, you may have to, it may be Lyme. And so testing for Lyme and this, this toxin, testing would be for the antibodies against the Borrelia bacteria, which hides. It's a little corkscrew shaped little guy, and it screws its way into your cells, for lack of a better term. And it then produces its toxin, which causes a lot of different symptoms, including fatigue and pain and so forth. So there are questionnaires that are really helpful in determining if you might be dealing with Lyme disease, because the blood tests, while they exist, they're very poor, they're very unreliable. When you have an acute, say you've been bitten, you've been bitten by a tick or a mosquito or something, and you get a rash, and you think, and you're starting to develop, this illness characterized by fatigue, and often severe fatigue. Then the tests might show up positive. Otherwise, if it's been a while since the bite, the bacteria hides in your cells and starts to evade the immune system. And so the antibody count goes down. So if you wait too long and check this in the blood, you're not going to find it, because there's not this continual stimulus for the immune system to make these antibodies. I hope that makes sense. And so doctors will miss it. They'll totally miss it. They'll test, it's negative, you must not have Lyme, so that's not it. But the tests are really unreliable. So false negatives are really high with this test. False positives are very, very low. So if it's positive, it's reliable as a positive test. And so again, unfortunately, if you wait too long, it's also difficult to treat, and no longer would antibiotics be effective. Okay. Other causes of chronic fatigue, parasites. I did a whole Wellness Wednesday on this. Really interesting. The parasites that tend to do this the worst are called strongyloides, or threadworm, and they can impact your brain and nervous system. That's why I say they tend to do this the worst. And so if they've taken hold in your nervous system, this can cause an extreme fatigue. I have a patient she was in Southern California. Part of her history was she remembers being bitten by something. She's not even sure. When she was on vacation in, I want to say I think she said it was in Italy. I don't think it was Greece. It's been a few years now. And soon after that, she began noticing how tired she was feeling. And this was really affecting her work. She ended up being quite debilitated, had been to several doctors, and including functional doctors. I mean, she had tried everything. She had tried the traditional medical route. She had tried the, functional, she had tried functional doctors. She had tried acupuncturists. She had tried pretty much everything, and homeopathic doctors. And she realized, after I spoke to her, that Lyme was a very real possibility, and it hadn't been brought up. I was really surprised at all of this, and that Lyme had never been considered, that parasites hadn't been considered, that that there was something else going on. She really didn't get that much relief when she was treated for Lyme, but when we started treating for parasites, this made all the difference. She became more energetic. Her brain her brain fog subsided, improved drastically. She's a creative writer, author, and she before she was able to get this under control, her creativity had been so stifled. She, her focus, her ability to concentrate, and her, her ability to produce, write, any stories it's like it wasn't there. So it was so fun as she started getting well with treatment of her parasites, that she informed me that she had come out with a new book. And it was just so cool. I was just ecstatic because she was able to beat this. So parasites can have a really big impact and causative effect for chronic fatigue. Okay. Anemia. So anemia can be really various things, various deficiencies. Iron deficiency would be like your most common. Sideroblastic anemia would be another one that's much less common, where you lack the ability to convert B12 or can't absorb it well. So there are, or I should say, I misspoke, megaloblastic anemia. There are different types of deficiencies that can certainly cause fatigue. When your blood is not carrying the oxygen that it needs because of iron deficiency, or the red blood cells are too big, so they can't fit through the smallest capillaries of the body, which only allow a normal red blood cell through, one red blood cell through at a time. So they kind of go through these little tiny vessels, single file. I mean, kind of imagine this. These tiny capillaries are so tiny that they only let one blood cell through at a time. Like, wow. And so if they're too big, they're not going to fit. You're not going to get circulation to your brain, to your organs, to your skin. You're going to be cold a lot with this. You're going to have, you might even have a neuropathy because of this pins and needles feeling. So yeah, anemias are causes of chronic fatigue. What about liver disease? Liver disease will cause chronic fatigue syndrome. Kidney disease will cause chronic fatigue syndrome, or can cause chronic fatigue as a symptom. I was mentioning some nutrients. Another nutrient that you have to consider is vitamin D. Okay, so you can get super fatigued with vitamin D. You can have a lot of pain with vitamin D deficiency. Just spoke with a patient today. She's noticing that as she ran out of the vitamin D supplement that we were giving her, she began to have pain, and then her blood sugars went up. Another cause of chronic fatigue and chronic fatigue syndrome would be mold toxicity. Mold is awful. Mold toxicity is terrible. And unless your doctor knows how to test for this, first of all, doing HLA-DR testing, and secondly, being able to find out what mold toxins you actually have, so that you can properly detox from that, you won't get better from this. It just won't happen, especially if you have a genetic predisposition to being susceptible to mold. Heavy metal toxicity will cause chronic fatigue. heavy metals take the place of minerals in your enzymes. And so in various biochemical pathways in your body, meaning the parts and pieces that do the work in your cells to make energy, to make different proteins, or hormones. This starts to break down everything when you are heavy metal toxic, because those parts and pieces require minerals, trace minerals, to work properly. And heavy metals come in and fill the spaces for those minerals to, help those parts and pieces act. And so the cell can't act properly. And finally, I'll talk about viral infections. Chronic viruses like Epstein-Barr, cytomegalovirus, herpes, herpes simplex, HSV6 is a not as common, but it is awful, and it causes a lot of pain. And it just zaps you. It just zaps your energy. So how do we find these things? Well, through comprehensive testing. That's the only way we're going to find out these things, through a process and treat them. How do we find and treat these causes so that you can get rid of the fatigue and get your life back? You have to get the right tests and go through the right process to test and treat and retest and recustomize and retreat. That's how it's done. All right. So I think I'm going to leave that there, and I'm going to foot stomp again. Masterclass, 5-day Fix Your Thyroid Masterclass for ladies, beginning October 2nd, going through the 6th. We'll be spending every evening together. Mark it, plan for it. It's free. 7 p.m. Pacific Standard Time, 8 p.m. Mountain Standard Time. Again, those of you who have attended in the past know how valuable this information is. We're going to, again, talk about the most effective way to treat your thyroid condition, or whatever. You're going to come with your symptoms. Could it be thyroid? Could it be something else? But we're going to learn, I'm going to teach you how to find out what the causes are for your symptoms. We're going to talk about a step-by-step thyroid blueprint that will help you, or can help you, like it has helped thousands of women like you. I will teach you how to determine what your proper thyroid supplementation will be. You will learn, why it is that doctors have trouble finding thyroid disease. And so why you still have these symptoms, even though your labs are normal. Okay. You're gonna benefit. I know you will. And I look forward to seeing you there. We'll be posting the link to sign up in the comments and the notes below this Wellness Wednesday. And so I hope to see all of you there. All right, ladies, have a wonderful rest of your Wednesday. Take care. Remember that you still have the power to heal. All right, take care.